Hello, good afternoon. Welcome to my case study presentation. So today, my case study will focus on a postpartum patient. She is Mrs. Mary Cruz, a 30-year-old patient who lives in Tindog, Dumaguete City. She gave birth to her third baby boy 3 hours ago. Upon assessment, she complains of having breast pain and expresses her anxiety to void in fear of having to feel pain in her vaginal area. Patients have fresh laceration in her vaginal area due to her latest childbirth. Her laceration has been stitched and requires adequate perineal care for healing. Patient's breast appears to be swollen, and she verbalizes, "Sakit akong tutoy ma'am, nagngulngul. Ako sad gipunggan akong pagpangihi kay mahadlo ko og sakit kung mangihi ko." For the patient's nursing health history, her chief complaint is that, "Sakit akong tutoy ma'am. Ako sad pinapunggan ang akong pag-ihi kay mahadlo ko nga magsakit." It is verbalized to the patient. The patient has no past illnesses, no past hospitalization, and no past serious injuries or surgeries. The patient has received complete immunization with reserved COVID-19 vaccine. For laboratory examination, the patient has none, and the patient has no current medication except for vitamins, and there is no allergies. The patient's menstruation started when she was 13 years old. She is regular every month, and the amount of blood that comes out monthly is moderate. For the obstetric history of Miss Cruz, she was asked if the pregnancy was planned, and she answered yes, we prayed for it. And the family and husband was also feeling blessed when the pregnancy happened. The history of pregnancy of Miss Cruz: she's been pregnant 3 times, and all of her babies were full term. The patient has a family history of diabetes mellitus and hypertension. Her granddad died because of diabetes mellitus and hypertension. The patient has been given a focused health assessment. For breast assessment, she appears to have a swollen breast, throbbing pain in both breasts, and small lesion in the nipples. For her uterus, it is firm to touch and not boggy. For her bladder, patient has not yet voided after the delivery. Patient has fear in voiding due to her expectation of pain in her vaginal area when she empties her bladder. Upon palpation of the bladder, the patient feels a little slight of pain. For bowel assessment, the patient has no urge to eliminate, and the patient has not yet eliminated since the delivery. There is no absence of sound in the bowel upon auscultation. The patient has no discharge, discoloration, redness, and edema in her vaginal area. The patient is also negative in her Homan sign. After all the nursing assessment, I have come up with a nursing diagnosis of acute pain related to postpartum breast engorgement, as evidenced by patient's verbalization of throbbing breast pain and discomfort. Acute pain is defined scientifically as the state in which an individual experiences and reports the presence of severe discomfort or uncomfortable sensation lasting from 1 to less than 6 months. The cause of the patient's pain is that she has given birth just 3 hours ago, and her breast is slightly swollen and she feels a throbbing pain. The patient is currently suffering from postpartum breast engorgement. The patient is experiencing this kind of problem because breast pain is caused by an increased blood flow in the breast, as the increase helps the production of milk. I have narrowed down 5 nursing management for the patient. First is to perform pain assessment by identifying the type, the location, the characteristics, the severity, and the duration of the pain. I will encourage the patient to use a relaxation technique, for example, deep breathing exercise, and diversional activities. Next is to provide comfort measures such as application of warm compress to both breasts for 2 to 5 minutes. Fourth is to instruct the patient to gently massage her breast before and after breastfeeding. Fifth is to instruct and apply cool compress or ice to the patient's breast after breastfeeding. This is to reduce the swelling of her breast. Next is medical and pharmacological management for the patient. First is to use a topical non-steroidal anti-inflammatory medication, or practice proper breastfeeding. Apply warm compress to the breast. Apply cold compress after breastfeeding to reduce the swelling. And lastly, to massage the breast gently before and after breastfeeding. I will provide the patient a health teaching, starting off by defining what is breast pain. Next is to identify with the patient the cause of the pain that she is feeling. Next is to teach the patient proper breastfeeding. The rationale of this is to the proper positioning of the baby, exact time and duration of breastfeeding, and proper interval between breast will help lessen the pain and ease the swelling. Next is to demonstrate how to put cold and warm compress to the breast. The rationale for this is the client will learn the method and will be able to do it herself at home. This will cause the muscle and blood vessel to relax. Next is to explain how the medication can help to ease the pain. The rationale to this is that patient will have knowledge about the effects of the medication she is taking to her body. For the second nursing diagnosis, I have come up with risk for infection related to vaginal laceration after childbirth and holding the urge to void. The scientific definition of this is that risk of infection is a nursing diagnosis which is defined as the state in which an individual is at risk to be invaded by an opportunistic or pathogenic agent, for example, virus, fungi, bacteria, protozoa, and other parasites, from endogenous and exogenous sources. The cause of this is that client holds her urge to urinate, lack of knowledge in proper perineal care, fresh stitch laceration in vaginal area from the client's recent childbirth. The client experiences such problems because she will be at risk of infection if there is no proper cleaning of her perineal area, and the stitches on her vaginal area might cause her infection if it is not cleaned properly. And the patient also holds her urine that might cause urinary tract infection. For the client's nursing management, monitor rate of uterine involution and nature and the amount of local discharge. Assess for pain when voiding, specifically pain scale, location, and the type of pain. Educate patient the importance of voiding and disadvantage of holding the urine. Identify methods to relieve patient from anxiety of feeling pain when voiding. For medical and pharmacological management, use a topical, non-steroidal anti-inflammatory medication. Perform perineal care. Keep the area dry and clean. Avoid using tight underwear. Wash with warm water and use warm water when showering. Take a bath every day. For health teaching, I will explain to the patient why she is at risk for infection. The rationale for this is that it will reduce the anxiety and worry of the patient and will encourage her to keep her good hygiene. Next, I will explain the cause of infection. The rationale for this is that the patient will avoid doing and encountering these causes that will help in preventing infection. Third, I will explain what is perineal care. Perineal care is a hygienic procedure in which the patient will clean her perineal area. Because of this, the patient will understand its importance in maintaining good hygiene, and also it will prevent infection. Next, I will demonstrate to the patient the proper cleaning of perineal area. The rationale for this is that the patient should know how to perform the proper perineal care to avoid infection. Next, educate the patient on the healing process on the stitches in the vaginal area. The rationale for this is that the patient can monitor the process of healing and and the patient will have less worry and fear because of the laceration. So that is what I have come up during my case study. I hope you enjoy my presentation.